Good morning, students. So today I am beginning another new chapter, that is cardiac poisons. So this chapter is also a very important chapter. Okay, and some of the poisons in this chapter are very common. Okay. So these cardiac poisons are also a lot of significant in medical legal point of view. So that's why this chapter is also one of the important chapters. So there are various poisons. Okay, they are basically mainly act at cardiovascular system, mainly over the heart. So we'll see one by one. We'll discuss one by one. So the most commonest cardiac poison among is tobacco. Okay, the scientific name is Nicotiana tabacum. Nicotiana tabacum. So it is most commonly called as a tobacco plant. Okay. So the plant grows around 1 to 2 meters height. Almost all the parts of the plants are poisonous, but dried leaves are most of the time we are using the dried leaves. Okay, they called tobacco or tambaku. Tambaku is the colloquial name, so commonly used name tobacco or tambaku. So this contain alkaloid, that is nicotine. Around 1 to 8% nicotine is present in this tobacco. And route of entry, that is mode of entry, most of the time it is used as for smoking and also snuffing and also chewing. Okay, so either the three modes. Active principle is one is nicotine, nicotinine, acrolein and anabasine. So among these four, the most commonest one is the nicotine. So nicotinine is less effective compared to the nicotine. So the nicotine is the most active ingredient. Okay, active ingredient of alkaloid present in the tobacco. So nicotine is more powerful alkaloid compared to the other alkaloids. So it can be enter into the body either by smoking or by snuffing or by chewing. So this is a tobacco plant. Especially the leaves of the plant is very broad leaves. Okay, so these leaves are dried and made it as a powder, and most of the time it is used in smoking, especially in preparation of cigars. So nicotine absorbs through almost all mucous membrane and skin, and it is also absorbed through lungs when it is used as a smoking, and when it is used as a snuffing, that is introducing into the nose, so it can be absorbed even through the mucous membrane, and nicotine can also absorb through the skin. So a cigar contains around 15 to 20 grams of nicotine. Each standard cigarette contains around 15 to 20 grams of nicotine, but only 1 to 2 milligrams only it is absorbed into the body. And though the concentration of nicotine is high in the tobacco, but it is actually absorbed into the body is very less quantity, that is around 1 to 2 milligrams. Nicotine metabolized in the liver, it is metabolized to cotinine, and of course it has got its entero-hepatic and also entero-enteric circulation. So that means though it is given through another route, but it is present in the GIT. So nicotine also crosses blood-brain barrier and also cross placental barrier. Nicotine also distributes almost all secretions including breast milk. So it is predominantly excreted through the kidneys. Okay. So nicotine develop a kind of dependence, so a kind of psychological dependence. So please remember students, this is important one. There is no physical dependence, it causes only psychological dependence. Okay. And when you compare to the various drugs which are available in the world, okay, so nicotine is the second most commonly used drug worldwide. So the first one, caffeine is one which is used, another alkaloid, and the second one is the nicotine, also used almost all worldwide. Okay, second most commonly used alkaloid, that is nicotine. So this is about kinetics. Okay, so when it is coming to the action, nicotine mainly it acts over the heart. So it produces coronary artery spasm. So this is very important point, students, please remember. When it is come to the pathophysiology of myocardial infarction, so one of the important pathophysiology that we discussed is coronary artery spasm. So nicotine produces coronary artery spasm. So coronary artery spasm, which can be resulting into myocardial ischemia and myocardial infarction. Okay, so that is one of the important action of nicotine over the heart. So it has got agonistic action with acetyl choline, cholinergic like action, and mainly it acts over the nicotinic receptors which are present to central nervous system and also autonomic nervous system, that is both sympathetic as well as parasympathetic. And nicotine also stimulates the release of certain hormones like ACTH, antidiuretic hormone, vasopressin, cortisol, growth hormone, prolactin, and also beta endorphins. Okay, it stimulates the endocrine release of ACTH, ADH, cortisol, growth hormone, prolactin, and beta endorphins. So another important point have to be remembered here is, in lower concentration it acts like a CNS stimulant, but in higher concentration it inhibits the central nervous system. Most of the people they use this alkaloid for purpose of CNS excitement, right? A kind of stimulus. Only in lower dose it produces CNS stimulation, but whereas in higher dose is called CNS inhibitions. It is also produce tremors and also produce convulsions. Okay, so it is very important point, students, please remember. So basically it also affects over the heart and it produces coronary artery spasm, so that resulting into myocardial ischemia, myocardial infarction. Okay, and that leads to death. So most of the time in smoking, the early deaths occurred because of the cardiac failure. Long-term use, of course, there are other effects we will discuss one by one. So coming to the signs and symptoms, individual will have a kind of nausea, vomiting, diarrhea, salivation, abdominal pain, and also it produces burning like sensation. And as I told you, it affects over the heart, it increases the heart rate, increases respiration, increases hypertension. So initially it causes increases heart rate, increased respiration, increased hypertension. Later it followed by it produces hypotension and bradycardia. So this is another important point. In early phase there will be a tachycardia and there will be a hypertension, but in a later part it develops hypotension and bradycardia. And it also affects over the central nervous system. It produces agitation, anxiety, ataxia, blurring of vision, confusion, headache, hyperthermia, restlessness. So it increases the sweating, it also produces tremors. Okay, there will be some amount of hyporeflexia, hypotonia of the muscle, which resulting into muscular weakness. Okay, so it affects over the eye. Initially there will be a miosis initially in early phase, and later individual develop mydriasis, and individual also develop convulsions and coma. Okay, and also sometimes in higher doses can also resulting into death. So these are the important signs and symptoms of nicotine poisoning. So chronic poisoning, that is especially the individual who develop some amount of habituation of smoking. So individual will develop a kind of anemia, and also sometimes individual develop even respiratory diseases that is chronic respiratory disease, chronic obstructive pulmonary diseases, COPD. So individual develop a kind of asthma, pneumonia, something like bronchitis. Chronic bronchitis is one important one you have to remember. Chronic bronchitis and also develop emphysema. So long-term use can also produce osteoporosis. So in a pregnant woman, so it can cause even abortions. Frequent abortions are very common, and it causes sometimes abruptio placenta, placenta previa, preeclampsia, and sometimes it also induces preterm labor. So which resulting into sometimes a kind of congenital malformations and intrauterine growth retardation, and sometimes it can also cause fetal death, intrauterine fetal death. So these are the dangerous effects are observed in a woman who is habituated of smoking. So another effect, chronic poisoning, it's called green tobacco sickness, that is increased BMR and weight loss. So long-term effect, those who are using cigar for a long duration of period, they develop especially cancers. So lung, brain, larynx, mouth, esophagus, stomach, liver, pancreas, bladder, breast and cervical cancer. So please remember students, all these organs, they develop cancers. So when they are using a long duration. And also, Alzheimer's disease also can occur in a long-term duration. As I told you, initially it will cause CNS stimulation, but later in a higher doses it produces CNS inhibition. So nicotine also produces psychological dependence. So if someone habituated to nicotine suddenly stops taking nicotine, and he develop a kind of withdrawal symptoms. So withdrawal symptoms are increased appetite, some amount of weight gain, increased respiration, increased sweating, and there will be an urge to smoke, increased desire to smoke. Individual develop an anxiety, depression, impaired memory and concentration, and individual also develop a kind of headache, muscle cramps and insomnia. So these kind of withdrawal symptoms are observed in individuals who are habituated to smoking when he suddenly starts smoking. Treatment for withdrawal, so we can give nicotine replacement therapy. So use of nicotine products, something like gums, lozenges and inhalers, nasal sprays, transdermal patches, and these are the alternatives can be used. So it is something like nicotine replacement therapy. So individual can easily overcome that habituation. Coming to the fatal dose, it is around 50 to 100 milligrams. Fatal period around 5 to 15 minutes. And diagnosis, most of the time it is diagnosed by estimation of the plasma nicotine level. If it is more than 50 nanograms per ml, we can diagnose that it is a nicotine poisoning. So 50 to 100 milligrams of nicotine, it can cause even death. So that is important point you have to remember. And management, especially acute poisoning. So we can do gastric lavage, stomach wash with potassium permanganate. We can use, can also give activated charcoal, forced diuresis, because it is usually excreted through the kidney. So forced diuresis. If individual develop a kind of hypo, that is bradycardia, and we can give atropine. And please remember, mecamylamine can be given. This mecamylamine acts like an antidote to nicotine poisoning. So students, please remember, mecamylamine is antidote to nicotine poisoning. We can also give hexamethasone and other symptomatic treatment. Coming to the chronic poisoning cases, so we can give coronary 200 micrograms per day for 1 month, and we can also give nicotine partial agonist, something like cysteine and lobalin, and nicotine antagonist like mecamylamine 5 to 10 milligrams, and nicotine replacement therapy. So this is one is very important, so that we can individual can easily overcome of habituation. And because of long-term individual also develop when he suddenly stop nicotine, and he may develop some amount of depression. So individual can also be given antidepressants. So nicotine replacement therapy, definitely it will be useful, especially for chronic poisoning cases, as in a part of replacement therapy which is highly recommended. So cause of death, in most of the time, as I told you, nicotine effect over the heart. So it can cause myocardial infarction, so that because it produces coronary spasm, so which leads to myocardial infarction and also cause cardiac arrhythmias, which can be leading to cardiac failure and death. And chronic poisoning, of course, individual develop a COPD, chronic obstructive pulmonary disease or chronic obstructive airway disease. Individual also develop a malignancy, cancer. So the most commonest cancer worldwide, carcinoma of the lung, so which is usually caused by smoking. So medico-legal importance, and it is an accidental poisoning because of some amount of habituation developed. So individual will become a psychological dependent to that poison. Sometimes overdosage can resulting into poisoning. So it can also be used as infanticide because usually it is mixed with milk, and it can be used as a cattle poison. So sometimes it can also be used to kill the stray dogs. And another important point is nicotine resist putrefaction. So the decomposition changes will be delayed, especially in nicotine deaths. So nicotine resist putrefaction. So these are some of the very important points have to be remembered regarding nicotine poisoning. Coming to the another poisoning is digitalis purpura. So this is another important plant poison. So digitalis is a drug which we also use in therapeutic, okay, especially to treat cases like cardiac failure. So even a therapeutic purpose of digitalis is used. A lot of significance is there, and of course in a higher dose it can also resulting into poisoning, and it can cause even death. So digitalis purpura, it is you can see this plant is very designed plant. The flowers are very designed flowers, okay. So purple color flowers, okay, highly attractive plant. So it was discovered by William Withering. The common name is foxglove. Because of the color of the flowers are purple, that's why it is called as purple foxglove, and it is also called as lady's glue. The name digitalis has come from the flowers which are arranged like a finger, so that's why the name has come digitalis, okay. So active principle is digitoxin, digitaline and digoxin. So digitoxin, digitaline and digoxins are the active principles. Coming to the signs and symptoms, because it is another important poison, it affects the heart. So it can cause even cardiac arrhythmias like extrasystole, atrial tachycardia, ventricular tachycardia, and also produce fibrillations, atrial flutter, okay. So this is another important one. So atrial flutter and atrial fibrillation. So it can cause even SA block or AV block, so which resulting into cardiac failure and even cause death. So it can also affect the GIT. It can produce anorexia, vomiting and diarrhea, and it has got some effect over the skin, produce urticaria, and it has got endocrinal effect, that is gynecomastia. So it affects over the eye, it produces photophobia and also xanthopsia. So xanthopsia is some disturbance in the color vision, especially the individual develop a disturbance of yellow color. So that's why this word is used, xanthopsia. And it has got effects over the central nervous system. Individual develop anxiety, confusion, delirium, and a kind of depression. So individual will be disoriented, confused, and also develop a fatigue, okay. So cause of death is ultimately due to cardiac failure. fatal dose around 15 to 30 milligrams of digitally or 10 milligrams of digoxin, and fatal period within 24 hours. Coming to the management, so gastric lavage is very important. We can do complete bowel irrigation, so we can also give purgatives. Activated charcoal is very important because this absorbs the poison, and we can also use tannic acid. And very important one is cholestyramine resin. Okay, steroid binding cholestyramine resin. So it prevents the reabsorption of the poison from the GIT, and it also interrupts the entero-hepatic and entero-enteric circulation. So we use cholestyramine resin. And there are specific antidote is available for digitalis toxicity, that is digoxin specific antibody fragments. So digoxin specific antibody fragments is called FAB. So there are two types, one is DigiFab and DigiBind are available, and we give a dose around 10 to 20 vials dose we supposed to give. And we can also give a supportive treatment, that is if an individual developing arrhythmias, we can give anti-arrhythmic drugs like Nicotine. If individual develop a bradycardia, we can give Atropine. And if severe cases, we can also do the hemodialysis. So students, please remember in the management of digoxin, very important one is FAB therapy, that is a DigiFab or a DigiBind. Okay, digoxin specific antibody treatment. Okay, this is very important. And we also given steroid binding resins, that is cholestyramine resin, because it prevents the reabsorption of poison from GIT and also interrupt the enterohepatic and entero-enteric circulation. So this is very important. Okay, you have to remember. So coming to the postmortem appearance, so when we open the stomach, sometimes we may find some fragments of leaves in the GIT and also stomach. So this is important, and all internal organs are congested. Okay, and usually we diagnosed by presence of digoxin in the body. That is very important. And medico-legal significance, accidental poisoning can occur. So by consumption of contaminated water and food and smoke from the burning plants, accidental poisoning can occur. And sometimes iatrogenic poison, maybe individual if we take a higher dose, so that can be resulting into a poisoning and that resulting into death. So this is about digitalis poisoning. So another important poisoning is aconite poisoning. Students, this is very important, aconite, and most of the time you can expect a question in the exam, aconite poisoning. So aconite, there are common names to this aconite. So the most common name is M.B.B.S, monk's hood. So this is also called as monk's hood, woman's bane, devil's helmet, and it can also called as blue rocket. So these are all the common names given to aconite poison. So M.B.B.S or M.B.B.S, monk's hood, devil's helmet, and blue rocket, these are the common names. And the root of this poison is very sweet, that's why it is most commonly called as a sweet poison. Okay, the taste of the root is sweet, that's why it is sweet poison. And this plant grows in Himalayas region, and it is a small herb, and it grows around 1 to 2 feet height. And very important is the root is a tuberous root. Okay, the root is tuberous, and of course all the plants, part of the plant is poisonous, but the root is more poisonous because the alkali concentration is very high in the root. And if you examine the root is dried root appears very dark brown color, and usually 5 to 10 centimeter long length, and important to find is it is a sweet in taste. So the result is also called as a sweet poison. So this is a aconite plant. You can see the purple color flowers, and this is aconite root. Okay. So usually 5 to 10 centimeter long. So dry aconitine, aconine, and pseudo-aconitine. So these are the three important active principles. It absorbs through all the roots almost. It enters into the body by all the roots, and it is mainly eliminated by urine. That is through kidneys. And its action is increases the sodium influx and promotes the premature excitation of myocardial muscle, so that resulting into cardiac arrhythmias, cardiac failure, and death in cardiac death. Signs and symptoms. So individual develop a kind of tingling like sensation when it is given orally, some kind of tingling and numbness like sensation in the mouth and throat. Individual develop excessive salivation, nausea, vomiting, and diarrhea. And very important point you have to be remember is it affects over the eye. So this poison causes diplopia and impaired vision. So this is important. And very important point is hippus. So this poison can cause hippus. So hippus is nothing but a alternative contraction and dilatation of pupil is called hippus. Alternative contraction and dilatation of pupil is called hippus. So hippus caused by aconine. So that is very very important. Aconite poisoning, very important point. It is sometimes entrance examination bit. So Viva also most of the time hippus, alternative contraction and dilatation of pupil. And it also produces effect over the muscle. It produces muscle weakness and also cause convulsions. So respiration becomes very slow, labored and shallow respiration. And as I told you, it produces conduction abnormalities. So cardiac arrhythmia, sometimes airway block. So that resulting into cardiac failure. So death occurs mostly due to cardiac failure. And coming to the fatal dose, it is around 1 gram of root, or 3 to 5 milligram of aconitine. Alkaloid 3 to 5 milligram of aconitine or 1 gram of root. So treatment, we can do gastric lavage with tannic acid, and we can give activated charcoal. So if individual develop a bradycardia, we can give atropine. So if the individual develop a arrhythmias, we can give lignocaine or procainamide can be given, and any other symptomatic supportive treatments. And coming to the medico-legal importance, this poison can be used as a homicidal poison because it can easily administer, because it tastes like a sweet, so that easily administered to the individual, and can be used as a suicidal, and of course the possibility of accidental poisoning is also there. So this poison has got a lot of medico-legal significance. So it can be used as abortifacient, poison, and fatal poison. It can be used as one of the best homicidal poison because in a lower concentration it can cause death. And another important point is it is sweet in taste, so that it can be easily administered to the individual. So another important poison, most common poison is Nerium odorum. So this is available. So it can be used as a garden plant. In most of the houses we can use plant, garden plant. So it easily grows everywhere. So common name is Nerium oleander. So another name is oleander, pink oleander, or rose water. Common names. So Nerium oleander, this is a scientific name. So Nerium plant. All the plant are poisonous. So it can be easily identified by its leaves, lanceolate, thick leaf leaves, and flowers are different color and fragrance. That is very important. Flowers are different color and fragrance. Some are white, some are red, some are pink, some are yellow flowers, and they are fragrant. and fruit is a long narrow capsule with multiple seeds, and they contain a small browny hair over the seed. And of course all the varieties of plants are poisonous, but red flower plant is more poisonous because the alkaloids are present in highest concentration in red flower plant. That's why it is more poisonous. But even other flowered other plants are also equally poisonous. So this is a Miriam plant. Okay, so the flowers are red in color, some are white, some are even yellow. Okay, so the leaves are typical lanceolate okay, shape and green color, and it grow very wild everywhere. Okay, so this is another dangerous plant. Okay, so it also produces a cardiac failure and death. So coming to the active principle, oleandrin, nerin, folinerin. Okay, so they are all cardiac glycosides. Their action is similar like digitalis. Okay, action is almost similar like digitalis. So clinical features, when it is given orally, it produces nausea, vomiting, diarrhea, profuse frothy salivation, and individual develop a dysphagia. So this is a difficulty in swallowing. Individual develop a muscular twitchings and also develop tetanic spasms. Okay, tetanic spasms, and later develop respiratory paralysis. Okay, and it affects on the eyes, pupils dilated. Okay, so because it produces respiratory paralysis, sometimes death can occur, either a cardiac failure or maybe sometimes death occur due to respiratory failure. So the two-way death can occur. So it can produce atrial and ventricular tachycardia, fibrillation and AV block, and this resulting in the cardiac failure. So it also affects all the central nervous system. Individual develop a drowsiness, convulsions and coma, and death occur mostly of cardiac failure, and sometimes it can also occur due to respiratory failure. Fatal dose around 5 to 15 leaves, okay, or 15 grams of root. Okay, so almost all the parts of the plant is poisonous. Okay, the leaves are also very poisonous. So around 5 to 15 leaves. Okay, so that can cause even death. Treatment supposed to give a gastric lavage. Okay, and should give activated charcoal. So this causes hypotension and bradycardia. So you should treat with atropine. And we should also treat hypokalemia, sometimes a potassium supplementation to be given. Like digitalis poisoning, here also we can give anti-digoxin fab. Okay, so this can be given. Okay, digifab or digibind can be given. If an individual develop a severe bradycardia, we can give an temporary pacing. So these are all other supportive measures we are supposed to give. So coming to the postmortem findings, all internal organs are congested. Sometimes we can find some leaves in the GIT in the stomach. So that is very, very important. Coming to the medico-legal importance, it is a most commonly used suicidal poison. Okay, so in a country like Sri Lanka, oleander is responsible for 74% of suicides, especially the individuals under 25 years of age. 74% of the suicides are due to this kind of poisoning. Okay, oleander poison. So most commonest suicidal poison in Sri Lanka. So it can be a possible accidental poison. Of course, homicidal, but rare because it is not palatable taste, and of course it can be used as abortive patient to induce abortion. Can be used as arrow poison. Can be used as cattle poison. Okay. The smoke from burning plant also can cause death. So this is another important point. Smoke from burning plant also can cause death. So So this plant has got a lot of medico-legal significance. That is why this is one of the important poisons. So another cardiac poison is cerebra-thivacea. Cerebra-thivacea. The common name is yellow oleander, and it is also called as lucky nut. Active principle: tivatin, tivitoxin, and nerifolin. So 3 alkaloids which are present in the plant. So yellow colored flower, okay. Something like used as a garden plant because of the designery flowers. Very attractive plant. So it produces clinical features like nausea, vomiting. It can cause ventricular tachycardia, fibrillation, and even AV block. So which can be resulting into cardiac failure and death. Around 5 to 10 leaves, fatal dose, or 5 to 8 seeds. Almost all the parts of the plant is poisonous, but leaves are okay. The glycosides are more in the leaves. 5 to 10 leaves are sufficient. Coming to the treatment, gastric liver, and we are supposed to give anti-arrhythmic drugs. Okay, if individual develop arrhythmia, and we are supposed to correction of fluids, and electrolyte imbalance is also important. So should correct the fluids and also give some electrolytes. So that is important. And other symptomatic treatment we can give. So stomach wash, okay, important. We can give activated charcoal. Okay, so those things are important. Coming to the medico-legal importance, the common suicidal poison, and sometimes it can be accidental poison. And another important poison is Cerbera odolum. And Cerbera odolum, Cerbera thivacea, and mostly observed in South India, okay, very rare in North India. Especially in Kerala, Cerbera odolum is the most commonest poison observed in Kerala, because this plant grows in the Kerala. So most of the time the Keralites, they use this plant for suicidal. That's why it is also named as a suicide tree. Suicide tree or RDL tree, okay, RDL tree or suicide tree, Tangena nut, okay, most commonly grows in the coastal regions, okay, and it is grown in the Kerala. So that's what they consume this for suicidal purpose. So that is why it is named as a suicidal tree. It grows very long tree. And very important point to remember is the fruit look like mango. So very important. The fruit look like mango with an ovoid kernel seed. Okay. So this on exposure to the air, the white kernel turn into violet, then turn into dark grey. Ultimately it become brown or black in color. Okay. And almost the entire the plant we can found some milky white latex coming out from the plant. We can observe. So this is odolum plant, Cerbera odolum. You can see this fruit. It is almost all mimic like a mango fruit. Okay, you can see here. The fruit is resemble or mimic like a mango fruit, and this is a deadly poison. Okay. So it can be used even other purpose like bioinsecticide. Can also be used as a deodorant. Okay, and sometimes used as a fungicide. So active principle: cerberin, odolin, and cerberoside. Okay, 3 important active principles: cerberin, odolin, and cerberoside. And the action is almost all similar like digoxin. So it blocks the calcium channel in heart, causing disruption of the rhythm. So it resulting into some conduction abnormality. Individual develop arrhythmias and ultimately develop cardiac failure and death. So clinical features: If it is given by orally, it produces nausea, vomiting, abdominal pain and diarrhea. So individual also develop abdominal pain. It can cause blurring of vision, respiration become irregular, and individual develop a tachycardia, ventricular tachycardia, fibrillation, and also produce AV block, and this resulting into cardiac failure. So most of the time the death occur from cardiac failure. Fatal dose, 1 fruit of kernel, okay, so is the fatal dose, okay, 1 fruit of kernel is the fatal dose. And treatment, we are supposed to do stomach wash, gastric lavage, and we can also give activated charcoal. So if individual develop a bradycardia, we can give atropine 1 mg. If individual develop arrhythmias, we can give anti-arrhythmic drugs. And important is fluid correction and electrolyte imbalance. And if at all any, we are supposed to do correction. So these are the important points. And coming to the medico-legal significance, so these alkaloids are difficulty to detect. Okay, so this is the most common method of suicide in Kerala. So all internal organs are congested, postmortem, and very difficulty to detect even by autopsy. And please remember, very commonest method of suicide in Kerala because this plant grow widely. So in Kerala. Thank you, students. These are some of the important cardiac poisons. Okay. Similarly, another plant, quinine, also is one of the cardiac poison. Quinine. As you know, the quinine has got a lot of significance. It is extracted from the cinchona plant. Okay. Cinchona, bark of the cinchona plant. Okay. Even quinine also, it affects over the heart. Okay, so higher doses can produce like conduction abnormality. Okay, individual will develop a kind of nausea, vomiting. Individual develop a headache. Okay, and CNS effect like ataxia, tinnitus, vertigo, some amount of even deafness. Okay, some amount of blurring of vision. Okay, and it also affects over the heart and produce conduction abnormality. And sometimes individual develop a cardiac failure and even death. So the quinine, you know very well because it has got some therapeutic significance and most commonly used in the treatment of malaria. And now you know hydroxyquinine also used as an antiviral drug. So these have got some medical significance, but in higher doses it can also act like a poison. Mostly it is a cardiac poison. Students, so these are some of the important cardiac poisons because these are mostly available, okay, everywhere in the world. So that's why these poisons are also very significant in medico-legal point of view. Thank you.